Greetings to all the viewers. I am Dr. Alisha, Research Coordinator at SIOR COP, and I'm going to take a session on sampling techniques today. Let me first share my screen with you all. So sampling technique, as you know, is an important part in the research process. And I'm going to discuss quite a few things about sampling techniques today. So starting with it, what are we going to cover in this session is that first is what is the need for a sampling process. There are a few terms related to sampling which I'll discuss about and the different types of sampling techniques that are involved in the research process. Firstly, we'll cover up why is there a need for sampling process. First is that we cannot study the entire population altogether. Sampling reduces bias in any research study. It ensures proper use of resources, and measurements will be better in sample than in an entire population because the number is small compared to a bigger population. And of course, the feasibility part of it is also there when we come to why do we need to do sampling in a research process. Sampling is the process of a technique of selecting a sample of appropriate characteristics and adequate size. This is the technical and the actual definition of sampling. Uh, so it is the process when we select a sample which has certain characteristics which is similar, and it will also be of certain size. Coming to some technical terms related to sampling. First of all, what is a population? So population is a collection of elements about which we wish to make an inference. So population is the population that we want to study, and we want to understand certain characteristics of that population. Coming to sampling units, so a population is made up of sampling units who are the individual units or entities that will make up the frame, just as elements are entities that make up the population. So population is made up of sampling units, and the sampling units will help us decide a sampling frame, which is the complete list of sampling units in the target population to be subjected to the procedure. So in the research study, to derive a sample, we need a sampling frame from the sampling units from the population. So it's like tapering down like this. So a population will have sampling units. A sampling unit will help us determine a sampling frame. And from that sampling frame, we are going to recruit samples for our study. So sample is a collection of sampling units which will be drawn from a sampling frame. There are two other terms. When we say parameters, we are talking about a numerical characteristics for a population. And when we say statistics, we are talking about a numerical characteristics of a single sample. So here, if you can see this diagram, the gray portion is representing what the entire population or the target population is. Say, for example, patients with ONE, they will come under the gray area that you can see in the picture here. And the red one is the sample which is the representative of the entire population who has ONE, which is taken into the study process. So population will be the population which we look at for the research process, and the sample is the one which we actually recruit in the research process. Here's an example for you all to understand the difference between population, sampling frame, and a sample. So for example, population is the population that we want to study, which in this case is all patients with type 2 diabetes patients in India. Now, if we have to derive a sampling frame out of this, you can see we can put a characteristic like type 2 patients receiving treatment in government hospitals in Pune. So this is our sampling frame. This is what we have access to. And from that, we are going to recruit uh, patients, or we are going to recruit participants which will actually be involved in the study. Those people are known as the sample. So here you see population, sampling frame, and then you come to a sample. So this is how the sampling process is actually carried out. What do we need for the sampling process? First is the sampling frame, very important. So once you have determined your target population, instead of directly jumping to the sample, we should always determine a sampling frame, which must be available. Otherwise, we have to develop a sampling frame. And once a sampling frame is determined, we have to determine a sampling method, which is what we're going to discuss in the next few slides. So this is a brief process of how the sampling process is carried out. First, we have to define the population, that is the target population. Then we have to decide the sampling frame. Then we have to decide upon the sampling technique. Then we have to calculate the sample size. And then we can actually start recruiting the samples for our study. We are going to talk about the different sampling techniques. Broadly classified are two sampling techniques. One is probability sampling and the other one is non-probability sampling. Talking about probability sampling, every individual in the population has a known or non-zero chance of being selected. It involves random selection, which reduces bias and improves the generalizability of the results. This is what probability sampling is about. So we'll take an example to understand this better. Suppose we are conducting a study to understand the prevalence of hypertension in a city. I have made a list of all households in the city and I randomly pick 100 households to survey. Why it is known as probability sampling? Because each household has an equal chance of being selected in the study. This will reduce the bias and this will really have a good generalizability of the results. Hence, random sampling or probability sampling is a preferred method of sampling in research because mainly because it allows all the samples or has or gives an equal chance to all the samples to be selected and reduces bias and improves the generalizability of the results. So this sample that we have selected actually represents the population well. Talking about non-probability sampling, here not every individual has an equal chance of being selected. The selection process or the recruitment process of samples is very non-random, which can introduce bias, but it's very easier and it's convenient and when accessibility is an issue or when resources are limited. So let's take an example here. Suppose I want to study eating habits among diabetic patients in a clinic. So what I will do is the first 50 patients who come to my clinic will be recruited in the study. Why it is called a non-probability sampling? Because patients who come to the clinic later or those who didn't visit during the survey period have no chance of being selected. So this method is more convenient and not random. This is known as non-probability sampling. Let us quickly see what is the basic difference between both the types of sampling. So probability sampling, that is random selection, and each person has an equal chance of being selected. While in non-probability sampling, there is no random selection and not everyone has an equal chance of being selected in the study. This is why probability sampling is more reliable for again generalizing results to the target population, while non-probability sampling is quicker and easier and convenient, but it can introduce bias. Talking about different sampling techniques that come under probability and non-probability sampling. So in probability sampling, we have a few types of other sampling techniques. One is simple random sampling, stratified random sampling, systematic random sampling, cluster random sampling, and multi-stage random sampling. We are going to see each one of us briefly and get an idea of what each of them is about. Then comes non-probability sampling. We have quota sampling, convenience sampling, purposes sampling, and snowball sampling in that. We'll quickly go through each of them along with an example. So simple random sampling, here it's very, as the word says, simple random. Every individual in the population will have an equal chance of being selected and selection is purely by chance. There are different methods of simple random sampling, say lottery method. You may have a computerized system that can help you randomly select samples in the study. Let's take an example here. Suppose we are conducting a study to understand physical activity levels amongst high school students in a particular city. Firstly, I'm going to make a list of high school students in the city and randomly pick 200 students using a computerized program. Why it is known as simple random sampling? Because every student in the city has an equal and a random chance of being selected in the study. So this is known as simple random sampling. Here you can see there's a population and we've randomly picked up certain samples, but these populations have a similar characteristics. Like say, in the example we took earlier, that these must be the students who are studying in high school. And we first make a list of students who are studying in the high school. And then from that randomly pick up 200 using a computerized program. Coming to systematic sampling, It is a type of probability sampling where every nth individual from a list of population is selected after we have a starting point. Say, for example, we want to study job satisfaction among nurses in a hospital with 500 nurses. So there's a hospital where we have a list of 500 nurses, and we randomly choose a starting point and then select every 10th nurse on the hospital staff list until you reach 50 nurses. So my sample size is 50. I have a list of 500 nurses. I start from the first one, say first the nurse on the number one, and then I keep selecting it like after one every 10th, then 20th, then 30th, till I reach 50 samples. That way I take that way I recruit 50 from 500 samples. This is known as systematic sampling. Why? Because after random starting point, you select individual at regular intervals in the example quoted here, every 10th nurse. So if you see the image here the starting point is the first one, and every third after that has been recruited for the study. So here, every third individual is recruited in the study. This is known as systematic sampling. Coming to stratified sampling, firstly, for stratified sampling, the population is divided into subgroups or strata based on a certain characteristic, say maybe age, say gender, and then a random sample is taken from each group. For example, I am trying to understand the effect of a new drug on patients across different age groups. So now I have a group of patients on whom I have to identify the effect of a certain drug. Now I'll divide these patients into different age groups. Like here you can see 18 to 30 years, 31 to 50 years, and people who are more than 51 years. And I randomly select 50 patients from each of these age groups. So here I have three age groups, and from these three age groups, I'm randomly selecting 50 patients. Why it is known as stratified sampling? Because I am ensuring that from each age group, I am dividing first the population into strata, and from each age group, I am randomly selecting samples. So this is stratified sampling. Here you can see we have a population first, then we will divide the population into subgroups as per their characteristics in the example given your age. And then from that strata, we will uh, select samples from each of the stratas that we have made. Coming to cluster sampling, here the population is divided into groups or cluster, and entire clusters are randomly selected from the study. In strata, we have first divided the population into subgroups, and from that subgroups, we have picked up few. Here, the population is divided into cluster, and randomly any cluster will be picked up to be included in the study. For example, if I have to study the dietary habits of students in a certain school across Maharashtra, I will select any 10 schools across the state, and I will then survey all the students in those schools. So after dividing the population into clusters, say there are 200 schools in Maharashtra, of that I have selected 10, and those 10, all of them will be included in the research process. Why is it called cluster sampling? Because instead of selecting individuals directly from a group, we are choosing the entire clusters itself. So this is cluster sampling. Here you can see the population is divided into clusters, and these clusters are randomly picked to be included in the study, not individual people from the clusters. Coming to multi-stage sampling, as you can go with the name, it's a more complex form of cluster sampling where sampling is done in stages like a funneling effect. We start with the larger clusters and then come down to smaller ones. For example, if I have to identify or assess the healthcare access in rural areas across a country, so first the country will be divided into states, then the states will be divided into districts, and then you go to villages and finally select random households within those villages for the survey. So why it is called as multi-stage? Because the country was divided into states and then districts and then villages and then households. So there are multiple levels of randomization involved here, which is why this method of selecting samples is known as multi-stage sampling. So quick recap of what all types of probability samplings are. First is a simple random sampling where every sample has a equal chance of being selected, and it is a pure random selection which can either be through a computerized program or through lottery method. Then we have systematic sampling, where every nth individual after a random start is included in the study. We have a start point after which we select every nth individual. Coming to stratified sampling, we first divide the population into strata based on certain characteristics, and then randomly pick up samples from each group. Cluster sampling, again, we have a population from whom we make clusters, and the entire clusters are recruited for the study. Multi-stage will be where randomization is done at different stages where it is a complex form of cluster sampling where we are trying to cover a larger area or a larger population. That is where multi-stage sampling comes into picture. So these are the different types of probability sampling. Next, I would be talking about the non-probability type of samplings. Coming to the first one, which is convenience sampling. You select participants who are easy to access without any random selection process. So the first thing about non-probability sampling techniques is that here we do not have any random selection. It will be a non-random selection, and these methods are used for the ease of applicability. So talking about the convenience sampling, we are going to use the samples who are at an easier access to us. Like example, taking this example where you want to study the eating habits of college students, you stand outside the college cafeteria and ask the first 50 students for you to complete the survey. So this is your convenience sampling. Why it is known as convenience sampling? Because we're simply choosing people who are easily accessible or available to us, making it convenient, but it is not at all random. Here you can see that researcher simply picks up participants or samples in the study who are easily accessible to him or her. Coming to purposive sampling, where we select participants based on certain criteria, like when we define inclusion criteria very stringently, very specifically, that's where it will be called as a purposive sampling. Like say we are wanting to study a new physiotherapy technique for on elderly patients with knee osteoarthritis. So I will intentionally select 60 patients. I will select patients over 60 years who are diagnosed with knee osteoarthritis. So here um, we can make this more accurate when it comes to inclusion criteria. So in this case, I will select patients who are over 60 years. I will select patients who have been diagnosed with knee OA. I will select patients who may have a specific type of knee OA and who are undergoing physiotherapy for more than 6 months. So here I have certain fixed criteria on the basis of which I am going to recruit samples in the study. Which is why it is known as purposive samplings, because we are choosing participants based on specific characteristics that fit the purpose of my study. So this is about purposive sampling. Next, coming to quota sampling. Quota sampling is more or less like stratified sampling, but here the only difference between stratified sampling and quota sampling is that here the selection of participants is not random. We divide the population into subgroups, but instead of randomly selecting, you only choose the samples until our quota is met. For example, if I'm conducting a survey on smartphone use among different age groups, again, see like stratified sampling, we have divided people here in different age groups from 18 to 30, 50 to 18 to 30, 31 to 50, and so on. So I have like three groups here: 18 to 30, 31 to 50, and people who are um, more than 51 years of age. I want to survey 50 people from each of the group. So instead of random selection, I will approach people in these age groups until I will fill the quota for each group. So suppose I got samples who fit my inclusion criteria. I will not do random selection. I will recruit samples as and when I have access to them, or as and when they are available to me, until I finish 50 samples for each age group. That is the main difference between quota and stratified sampling. Here we do not have random selection. So this is known as quota sampling. Coming to snowball sampling, which is the most preferred by undergrad students or very basic research projects where we have to do surveys of prevalence, especially when it includes population who can fill forms by themselves. So you start selecting a few participants, then ask them to refer others, and the sample snowballs as more people are added to referral. For example, if I have to understand perception of physiotherapists towards certain things, so I may roll out a form to 10 physiotherapists I know, and those 10 will spread the form to more 10, and those other 10 will spread the form to more 10. So this is known as snowballing, and this type of sampling technique is known as snowball sampling. So your sample grows by referrals, where participants only will help us to find more participants from their network. This is known as snowball sampling. Here you can see the researcher gives the forms or the scales to 3 samples. This will then send to more 4 samples, and then it keeps on going until your sample size is completed. This is known as snowball sampling. Coming to consecutive sampling, you take all available participants who meet the inclusion criteria over a specified period until I reach the desired sample size. Suppose I want to assess patient satisfaction in a hospital. Over a period of 1 month, I will survey every patient who is visiting the hospital and who is giving consent to participate in the study until I reach the number or the sample size of 200. I will keep doing this over a period of 1 month. This is known as consecutive sampling. Again, this is not random. You are selecting any patient that is visiting the hospital and who is willing to participate in the study. So summarizing all of them, convenient sampling is choosing patients who are easy to access or participants who are easy to access. Purposive sampling, we will select patients based on a specific criteria. Quota sampling is like stratified sampling, the only difference being that here we are selecting patients non-randomly. Snowball sampling is we start with a few participants who will help us find other participants in the study. And consecutive sampling is you keep on recruiting samples in your study till you reach a certain number. And this is also over a period of specified time. So that's all about sampling. And in conclusion, I would just like to say that for any research based on study design and objectives, it is very important for us to find an appropriate random sampling technique. So to generalize the findings, like I told before, first we need to have a target population. From that target population, we need to define as a sampling frame. And from that sampling frame, once your sampling frame is selected, you need to determine what sampling technique we are going to use. How do we come to a type of sampling technique is after we are clear with the study design and the objectives that can help us determine which sampling technique will be useful to a particular study. And once that is done, we calculate the sample size and then we go about recruiting the sample. So this is all about sampling techniques, and that's it for my session today. I would really like to thank Dr. Parag Sancheti sir, Mrs. Manisha Sangvi ma'am, Apurva Shimpi sir, and the entire PhysioTV team to give me this opportunity to speak about sampling techniques on the PhysioTV. Thank you so much.